My name is Burns Brady, and I'm an alcoholic. And, to hear someone from New York who's been kind of bastardized through South Carolina try to say Louisville, it's just almost, it almost makes you want to throw up. But you did a good job. You did a good job. That's really better than most Louisvillians do, I got to tell you. I assume the ones who are here today really have some true inquisitive nature, some questions to want to know about what we keep calling this a disease about. We always keep calling it a disease. And as you well know, in the doctor's opinion, he talks about a physical allergy and a mental obsession. And I've always marveled at the intuition and the intelligence of Silkworth and Wilson, because they were able to nail at that time, based on observation alone, what today we have a whole bunch of formulas and a whole bunch of information to tell us. We're not saying a thing different today than we were saying in 1935 and 1938 when the big book was written. We're just able to nail it better as far as equations and why are we bodily and mentally different from our fellows. And I think it's real important for all alcoholics to understand that we are bodily and mentally different from our fellows. If you don't believe it, ask. I'm an instructor at the University of Louisville School of Medicine. I also run the Impaired Physicians Program for the state of Kentucky, and I do the addiction work for a men's and women's homeless shelter where we sleep 250 men and women a night and have 150 in a year-long program of recovery. We were just selected as one of the top 5 treatment programs in the United States. This is for indigent homeless shelter. And I do all of that, plus go to 3 to 5 AA meetings a week, and I've been doing it for 21 years. And I got to tell you, long before I studied this disease, I knew we were bodily and mentally different from our fellows. And when I send our medical students to attend AA meetings, open AA meetings, they come back and say, in essence, you are bodily and mentally different from your fellows. And they are just tickled to death because we're all in the same room together, because they're scared we might get out in public as a group, and God knows what we might do in public as a group. I've listened to circuit speakers talk from the podium and say that we're not bodily and mentally different. We're no different. That's just not true. And what I say sometimes for humor is normal people bleed when we cut them. They cry when they lose somebody. And I practiced medicine for 25 years before I started running the Impaired Physician Program, family medicine, so I listened to tons and tons of people come through my office, and they reacted to the same things we react to. They don't react the same way. When they're at a stoplight and it turns green and somebody honks their horn, they just pull on off. We get out and slap hell out of whoever it was in the car behind us, or if we don't, we give them the finger, or we spend the next 4 hours wanting to know why we were such a wimp we didn't get out and whip their butts. You know, I mean, I don't know about you, but if you're a drunk of my type, that's exactly, you'll ruminate on it for a week of why you didn't let the SOB know that yours is as big as his is. Now that's for men. I don't know what you women do, but I can tell you, the few that I've been around, I don't work with women for a lot of reasons. That's in my best interest and in their best interest. But y'all don't act a hell of a lot better than we do. You're just a little smoother about it about half the time. Except for people like Sheila, and she tells it like it is, and that's the way it was. But she was also a young female drunk, and they're entirely different from old female drunks. Same thing is true as young male drunks and old male drunks. Always end up in the same spot, but they're different. Different in their presentation, and different in how they. The only similarity is that they can't drink like normal people. But there's a whole different presentation. We'll get into all of that. So I've told you my credentials. I've dealt with thousands of street drunks. I've dealt with hundreds of physician drunks, and going to meetings, I've dealt with hundreds and thousands of regular drunks, if you want to, at both poles. So if I haven't seen it, it probably hadn't happened. I mean, that's just it. If I haven't done it, then it's just because I haven't thought of it, you know. And I usually can think of most of it. I think it's really important for us to realize that There are some people who won't be here this afternoon because they don't think it really matters that we've got a disease. I can only tell you that Bill Wilson reported that that was probably the single greatest piece of information that he had brought to him that enabled him to start this journey. He was a devout member of the Oxford movement. He had a relatively decent assimilation of a relationship with God, not like where the spiritual awakening that he had, but he kept thinking in terms of being bad rather than being sick. And when Silkworth brought him that piece of information, it absolutely changed his life. And this is recorded in the history of Bill Wilson and the things that he has stated. So it really is important for us to know that we have a disease, or it is for the people I've worked with, so that we can table this thing about being bad and start dealing with things about being sick who did bad things. And under no circumstances is the concept of a disease to absolve us of the responsibility of our recovery. And people who want to avoid the consequences of their behavior based on being an alcoholic are pretty well doomed not to get sober. Pay unto God what is God, pay unto Caesar's what's Caesar's. When I get a DWI, by God, they should find me. And if I get two, they ought to put me in jail or whatever the hell it is. When I tell the policeman who stops me that I'm an alcoholic, you know, even in recovery, I'd say, they'd stop me and I'd say, I'm a doctor, I'm rushing to an AA meeting, and I've got to help some drunk. Then they just wrote the ticket quicker. And that's exactly what they should have done. They said, Doc, we're really happy. Here you are, you know. And I thought, well, screw them. You know, they don't understand. But many, many times, and the Americans with Disabilities Act has been really pushed to enable us to absolve ourselves of the responsibility of our recovery. I'm absolutely in agreement with Richard when he said today, we are generally not responsible for our disease, but we are absolutely responsible for our recovery, and to try to use the disease as an excuse is to distort it and to prostitute it. But I think it really is critical to know we have a disease, how we are different, and how we will have to deal with it. Now, I'm going to be talking for somewhere between the next hour and a half to 2 hours. If I talk articulately and your butt doesn't go to sleep, I think the material itself will keep you right on target. If you blink, you're going to miss it, because this presentation I'm going to do today, when I do it to doctors, it takes me a day and a half to 2 days. They're just not as smart as you people, and I'm not really no, let me tell you, they're not as desperate as you people. You know, to them it's an intellectual endeavor. To me, it's like, you know, it's like the pig and the chicken when they're sitting there talking about breakfast. You ever heard that? And the chicken's all happy as can be, and the pig's just shook up. And the chicken says, "Why are you shook up? It's a great meal." And the pig says, "Because for you it's a contribution. For me it's total commitment." And for the alcoholic won't know about his disease, this is a deal of total commitment. To the doctors, it's kind of an intellectual deal. Now, I'm not going to shortchange you. You're going to get the same material they'll get. But I'm going to have to condense it, and if you blink, and for some alcoholics in the first 5 years of recovery, your concentration is somewhere between 0 and -5. So you may have to get up and do a pirouette every now and then. I'll know you're not having a seizure, you're trying to wake up. And that'll be okay. And the rest of you forgive them, because that's what they're going to do. Let's look at what we got. Alcoholism was defined by the American Medical Association as a disease in 1955. We defined drug addiction as a disease in 1987. I continue to be intrigued by those people who continue to consider themselves professionals in the field of mental illness, who do not want to call this a disease, who still want to call this a secondary problem. If you were improperly potty trained or lusted after your mother, that's what made you a drunk. Now, please don't hear me by saying that you shouldn't revisit your family of origin stuff. But if you're going to live there, you're not going to get sober. But if you don't go back there, you're probably not going to ever know where the bullets came from. Look at the 5th chapter and the 4th step. It says we go back through our lives. Nothing counts but thoroughness and honesty. But that group of mental health people continue to call this a secondary illness. It is a primary illness, well defined. I won't get into defining a disease. I think that's basically a bunch of semantics. And when I'm on a podium with a bunch of us so-called experts in the field of addiction medicine, I'm board certified in family medicine, I'm board certified in addiction medicine. And when we get there and get to talking about what is the definition of a disease, I just sit back and prop my feet up and said, when y'all get finished, let's talk about what's serious. Because I'm not going to get into that. We defined it as a disease, and we're the pros, we're the doctors, we're the specialists in disease. Stanley Getlow, who's one of the leading educators in this field, called this disease sedativism. And what he meant is not that a drug is a drug is a drug. That's not, and a lot of people thought he meant that. What he meant is the alcoholic will not be able to process mood-altering medication like a normal person. That's an entirely different deal. It's an entirely different deal. And it's real critical for us to remember that we will not process mood-altering medicine like a normal person. My story. And I'll get into more of it tonight when I talk, but the short version of it is that in 1958, and my high school and college years were no different from anybody else, frankly, as far as drinking and drugging. I didn't drug and I didn't drink that much. But in 1958, when I started medical school, I started taking amphetamine, speed, to study. Was hooked on it almost immediately. 12 years later, after 4 psychiatric hospitalizations, getting kicked out of medical school, I mean, the whole horror story. I didn't drink during those 12 years, just the amphetamine. I quit taking amphetamine. I may get into that tonight, I may not, but I quit taking amphetamine. Then I started drinking. And the first 4 years of my drinking wasn't alcoholic. I didn't drink that much, I didn't drink that often, didn't think much about it, never even considered whether I'd get drunk or whether I'd stay sober. And it didn't impact my life. I had a huge family practice, it was not difficult. The next 3 years of my drinking was alcoholic. I didn't drink as much, I didn't drink as often, but every minute of every day, I knew when my first drink was going to be. It was going to be at 4 o'clock. My total obsession was alcohol and when I would get it. And the last year of my drinking was addictive. And I drank a quart of whiskey a day or a night. Told myself I wasn't an alcoholic because I never drank in my office. And I'll sit and tell you tonight about where I had the shotgun in my mouth and that moment of truth. But that was 12 years of amphetamine with no alcohol. 8 years of alcohol with no other drugs, same sewer. There were some differences, and I'll talk about those tonight. 17 years sober, I had a heart attack. A big one. Almost died. Rolled me into the emergency room. I knew the guy, hit me at home. I grabbed Casey. I knew what was going on. I was in trouble. Big trouble, and I knew it. And I didn't even have time to call the EMS. I said, get me to Jewish Hospital. That's the heart center in Louisville. She got me there in about 10 minutes. I ran in, grabbed the emergency room guy. I knew him. I said, I'm having a heart attack. And he said, jump on the bed, Burns. Did the EKG and said, yeah, you're having an anterior septal heart attack. That's one of the bad ones. There's not any good ones, but that's one of the more severe ones. And he said, you're really in trouble. And so we grabbed the heart doctor outside. It's interesting how provincial we get as doctors. Now, I did this when I was a student, but he said, who's your heart doctor? And I remember even sitting there dying. I thought, well, you crazy son of a bitch, whoever's out in the hall's my heart doctor, for God's sake, you know? I mean, I'm going to call your family doctor. Right. Father Martin says, don't call me a priest, call me a doctor, you know? So they grabbed a guy who was a good friend of mine. He happened to be there. He came in, gave me some magic medicine that dissolved the clot. That's the good news. The bad news is it threw me into 2 immediate bouts of ventricular fibrillation. That's what kills people when they have heart attacks. And I passed out, and he shocked me with the electric shockers. I came to, and I said, Dan, what happened? You had ventricular fibrillation. And I said, how am I doing? He said, you're pretty stable. But this time they had me full of a bunch of morphine. So I'm having an existential experience, quite frankly. You know, I'm sitting there, I mean, I'm floating. And then I started to pass out, and I said, what's the matter? And he said, you're fibrillating again. I can't let you pass out. So he put those suckers on my chest, and this time I'm awake. And everything you see on ER is exactly the way it is. Only I'm so full of morphine, I'm popping up off that table, and I'm thinking, this is really neat, you know, bam, like that. But you talk about post-traumatic stress disorders. That was going to come back and has since that time, because today I can think about what went on in that emergency room, and there's, for you males, you know what I'm talking about, there's a muscle called a cremasteric muscle, and it's what pulls our testicles back up into our body when we get scared. And animals, when they get in a fight, they'll do that so they don't hurt each other in their testicular area. And if you have a cremasteric reflex, that means when something scares you, and every now and then I'll go around and think about that heart attack, my testicles go like that. Now, then it didn't bother me, you know. Then it didn't, but I can think of it now, and the men are all laughing, the women are going, I don't know what are you talking about. But just trust me, that's the way it happens. That's the way it is. Y'all don't have toys like we do. That's just the way it is. And so we have neat things that happen to us. Y'all just walk around having babies and periods. I don't know what it's all about. But we have these neat things happen to us. But after it was over, I was real fragile, both physically and emotionally. And the doctor said, because I'd almost died. And I mean, I was in trouble. I mean, physically in trouble as well as emotionally. He said, we can't cath you for 4 days to find out exactly what's going on. So you're going to have to wait 4 days. I'm going to put you on IV Ativan. Now, Ativan is turbo Valium. And when he said he was going to do that, I said, I need to call Charlie Frankie. He's an addiction specialist like me. And he said, why are you calling Charlie? I said, because that medicine's going to screw me up. And he said, then I won't give it to you. And I said, would you give it to any other heart patient where I am? He said, yeah. Oh, yeah. And I said, then you give it to me. Because you saved my life. Charlie's going to come in here and save my soul and get me where I need to be. And we tell people about taking medicine. And I remember when I came back from treatment, they drilled me with this. And it's a good drill. It's a good drill. And I came back and I had a couple of things happened. One is I had a kidney stone within the first 3 months. And I woke up in the middle of the night and I knew exactly what I had. And I said, Casey, you have to take me to the emergency room. So we started over there and the stone quit moving. I said, now when I get there, I can't take any Demerol or morphine. I'm an alcoholic. And it wasn't moving. So they rolled me in the emergency room and it started moving. And I said, give me Demerol, give me morphine, give me Dilaudid. And the nurse came in, she said, you know, I've had kidney stones in babies and they're about equal. And my first response was, why did you ever have the second baby? My God in heaven. I mean, this kidney stone's about all the fun I can tolerate. But I took that medicine and should have. The other thing is I had a vasectomy. So they rolled me in. They said, we can put you to sleep or we can do it under local. And I said, I can't take medication, so do it under local. And about that first time that needle went into my testicular sac, I remember thinking to myself, I have made a huge error in judgment, you know? And there's a thing called orthostatic. When that cremasteric reflex happens, sometimes it causes the blood pressure to drop, and it's called orthostatic hypotension. You sit up and you faint. You sit up and you faint. For 3 days, I'd sit up and faint. That's what I did. And Casey brought me a fruit jar, and I'd lay on the bed and pee in the fruit jar, because when I got up, I'd pass out, so I'd just pee on the bed. So I'd pee in the fruit jar. So after 3 days, I called my sponsor, because now the blood pressure is back to normal. And I said, Jim, you'll be proud of me. He said, why is that? And I said, I had a vasectomy under local, had orthostatic hypotension, couldn't sit up for 3 days, but I didn't take any medicine. He said, you're an idiot. You know, now, the message for this part of my message is we take what we need, but we have to do it with an umbrella under us at all times. I had Charlie Frankie in there, and let me tell you what happened. For 8 days, they gave me IV Ativan. I'm 17 years sober, one of the top addiction specialists in this country, working a good, solid program of AA. They gave Casey the medication to taper me. One of the ways we do this is you take so many the first day, so many the second day, so many to go 8, 8, 8, 7, 7, 7, 6, 6, 6, 5, 5, 5, 4, 4, 4, 3, 3, 3. It's called the taper detox. 8 days. Gave Casey this. After 4 days, they cathed me, wrote a router out in my artery, did a bunch of neat stuff, and my heart's okay. And so I went home, she gave me the medicine. On the third day, and she and I differ in what and I'm sure what she saw is the truth, because what I was in was a partial blackout. But what I knew was, what I remember is that she was sitting there, and I walked over and picked up her purse, took out all the pills, there were about 20 of them, and took them. Now what she says is that I went over there with her not in the room, she was in her closet and took them out and took them. But the fact is, I walked over and took them out of her purse and took them all. And I remember her saying something to me, and what she subsequently told me was, she said, what the hell are you doing? And what I said to her, and I didn't know what I said, was, this stuff's screwing me up, and when I get it all taken, I won't have to take any more. Now, what I did remember was walking over almost right after that and sitting on the foot of the bed looking at her and saying, I'm going to have to write a prescription and get some more of this in the morning. And she started crying, and I started crying. She says, it's got you. And I said, it's got me. And they took me to the mental hospital, and I went through 8 days of a bone-rattling benzodiazepine detox. I was dog meat with that medicine. So what Getlow was saying, and that was 12 years of amphetamine with no alcohol, 8 years of alcohol, ended up drinking a quart of whiskey a night. I'm a true alcoholic. And 8 days of Ativan with none of the others, and the medicine, boom. And there's a whole list of medicines that we can't take. And Getlow calls this sedativism, meaning the alcoholic will not be able to process mood-altering medicine like a normal person. Now, for the purpose of this presentation, the neuroanatomy and the neuropharmacology I'm not going to go into to a total depth. But let me tell you, the neuroanatomy and the neuropharmacology, the brain chemistry and the brain anatomy, in its final common pathway is identical for all drugs. Doesn't mean the clinical presentation is the same, because my 12 years of amphetamine was entirely different from my 8 years of alcohol. They were as different as daylight and dark in the way I presented, the things I did, except for the complete loss of any sort of reasonable control or ability to take those medications. The presentation was entirely different. This is what Richard was talking about today. Is in Alcoholics Anonymous, we share a common experience. That's what brings us together, is that common experience. I can talk to a drug addict and I can talk to an alcoholic, because I can talk my drug shit with a drug addict and I can talk my alcoholic stuff with the alcoholic, but I got to tell you, they're different in their clinical presentation. And we attract in this program of attraction because of the similarity, not the differences. Now, we stay together, and if you read There Is a Solution, it's real clear. We stay together because we find a shared common solution. But we come together because we're attracted to each other. And I worked with hundreds of cocaine addicts, and I can get a little bit close to them with my amphetamine. But you put one cocaine addict working with another cocaine addict, you got to go. You got to deal. You put a pure alcoholic with a pure cocaine addict, and you got people talking apples and oranges. They don't even react the same in treatment programs, much less than a meeting. They don't even act the same in treatment programs. Now, I'm not here to, at least not in this presentation, and tonight I may. It all depends on where God takes me and how wound up I am. But I'll get to talking about a lot of other stuff. But right now, let me tell you, this is a clinical presentation. This is not an AA meeting, and I can say that without any reservation, because I'm talking as a professional who has dealt with thousands of people with these clinical pictures. So it's clear that we do not process mood-altering medication like a normal person. This disease is chronic, progressive, fatal, and treatable. Chronic, no known cure. It's real clear in the big book. 10th chapter, or the 10th step, 6th chapter. Alcohol is subtle. We are not cured of our alcoholism. We have recovered from a hopeless state of mind and body, but we are not cured of our alcoholism. Okay? And this is a real critical difference if you want to start trying to get into those semantics to understand that we are not cured of our alcoholism. We have a chronic disease. Now, there are all kinds of magic bullets being perfected in research today. The current naltrexone craze and all the other stuff that's going on to treat alcoholics. There is no magic bullet, because how are they ever going to be able to cure that hole in my heart? They may even take away the ability for me to have a compulsion to drink. But they're not going to cure the disease of alcoholism with a silver bullet. Because the book is real clear, 5th chapter, 4th step, we have a physical, mental, and spiritual disease. When we clean up spiritually, the others will almost invariably follow. Read it. That's about what it says, almost verbatim. Almost verbatim. So when people start talking about these magic bullets, all they're talking about is a pill that will take away the compulsion to drink. My compulsion to drink has been gone for 21 years. My disease is as alive and as well today as that SOB was 21 years ago or 62 years ago. And in Richard's talk today, he gave one of the most classic definitions and presentations of the difference between the disease of alcoholism and drinking. He drank to deal with his disease of alcoholism, and because of the physical allergy, he hooked into the booze. But he was drinking to deal with the disease of alcoholism. And we're going to look at that whole disease. The price of admission is to stop drinking. The treatment is how to deal with the disease. So it's a chronic disease, no known cure. Progressive, there are two forms of the progressive nature of alcoholism. One was defined by Dr. Jellinek in the late 50s and early 60s. He described a 6.5-year or 7-year mean average of drinking. A person hits a crisis, shotgun in their mouth, whatever it may be, but this is the crisis. And then 3.5-year mean average back to where we look and act normal in recovery. Many of us look and act normally, but I got to tell you, if you're an alcoholic of my type, you ain't even close to being in the real world. You ain't anywhere near normal on the number of people that are out there. We're a minority, the alcoholic, and we're not like those people, as I said earlier. I look like them, I can dress like them, and it's my job to learn to live in their world on their world's terms. Not their job to figure me out, but I ain't like a damn one of them. And when I get through, you're going to understand why I'm not like those people. If you're an alcoholic of my type, you're not either. This is what Jellinek described, and he was really describing what we know today as the adult form of alcoholism. But there's a juvenile form of alcoholism, which is an entirely different ballgame. The other forms of progressive nature of alcoholism is if I start drinking today, and we've seen this historically, if I start drinking today, it's almost like a Steven Spielberg movie. First we'll go judgment. Then we'll go rational behavior. Then the whole thing kicks back in as far as the addiction to and the inappropriate, compulsive, and obsessive drinking. And the longer a person's been sober, the more rapid it hits and the more severe you can see it because it's stark. And this will occur within a matter of a few weeks to a few months or even sooner. A person who relapses early in the first 5 years, they're not as stark because, hell, they're still about half crazy anyway. And you watch them bobbing around, and you don't know they got crazier when they start drinking again. They're nuts anyhow. But you take some, and if you've got less than 5 years sobriety, if you take that personally, just listen to me. Because for the first 5 years, I was just lucky to get in the right restroom, you know. And everybody thought I was a pervert. Hell, I couldn't figure out what the skirt was and what wasn't the skirt. I didn't know what that little tent was, you know. And it's almost that bad. Losing my car and and all that kind of stuff. And we'll get into the post-acute recovery syndrome, which is that's a part of it. But it's really stark. I've made 12-step calls on one man with more than 40 years of sobriety. Made I don't know how many on people with more than 30 years of sobriety. And it's really stark. And interestingly enough, the guy with 40 years of sobriety died sober. The number of people I've made 12-step calls on with more than 30 years sobriety, none of them died sober. They all died drunk. It's really difficult, and it's really traumatic. But that's part of what is going on, we don't know. Some research gives us some insight into it with what we call the aldehyde condensation products, or the old THIQ, which many of you have heard about, which is still not anywhere near the Bible that it used to be, and I'll address that, but it's probably the window. The National Institute on Alcoholism and Alcohol Addiction has just allotted $50 million to study 6 major components in 6 major sites on alcoholism. And the aldehyde condensation products, or THIQs. One, there's female alcoholism that's being studied in depth, and the genetics of alcoholism. Those are the ones that interest me. There are 3 others, and they don't interest me that much. They're more academic. They don't have as much to do with clinical stuff, and that's where I really live and breathe and work, is in the clinical environment. Fatal, this disease is 100% fatal. Cirrhosis, pancreatitis, GI tract cancers, I can go all down through the physical stuff. Homicides, suicides. 95% of the beds in the trauma unit at the University of Louisville Medical School, which is a major trauma center, 95% of those beds are occupied as a direct result of alcoholism. 95%. So this is a disease is 100% fatal. 100% fatal. And the seminal issue for every alcoholic, and I will talk about that in my story tonight, is when we decide and make the commitment, do you want to live or do you want to die? And when you read the chapter to the agnostic, it says to die an alcoholic death or to live a spiritual life is sometimes a tough call. And you think, huh? Yeah. Do you want to live or do you want to die? And every one of you, if you got to the point I did, dying seemed the most obvious, logical, and acceptable. And that's why the instance of suicide in the alcoholic population is 17% greater than the normal population. We get to the point of being hopeless. That's the bad news. The good news is we get to the point of being hopeless. And those people that it still works for who never got to that point, I take my hat off to them, because some of them are still sober and working a good program. But I tell you what, I think they have to work harder than I do, because I got nowhere else to go. And they may still have another drunk. I truly in my guts don't believe I've got another drink. I've heard people say I may have another drunk, but I don't have another recovery. I don't think I got another drink. That fear alone won't keep me from drinking, but it sure can keep your attention till you figure out how not to drink. It can sure as hell keep your attention. 100% fatal. Treatable. New England Journal of Medicine and JAMA both reported in the late 80s that if you treat physicians, and I do this for physicians, correctly, now the operative word is correctly, there's a 90% chance of recovery at the end of 5 years. You treat the normal population correctly, 70% chance. Now the operative word is correctly, and I absolutely agree with Richard today. In fact, I agree with about 99% of the talk he gave, and the 1% I disagree on is just a matter of degree, and I think I've just had a little more experience than he's had in one or two spots. But in principle, I'm 99% in total agreement with that talk he gave today. And I got it. So you may not want to come to tonight's talk. It may not be, if it pissed you off, you want to come. If it didn't piss you off, you probably can't wait to get there. And I really mean that. I really do mean that. And I do believe that the rate of recovery is somewhere between 1 in 37 or 5 to 10%. But the operative word is correctly. Now, in our impaired physician program, what we do is when we intervene on these docs, immediately when we go in, we intervene, we do our own evaluations, we do our own interventions, we do our own initial treatment. When they come back, they go into physicians' recovery groups. They go to AA anywhere from 5 to 6 times a week. And so Big Book says you don't do that. I agree with that 100% for regular drunks. But I've come to know, after 400 physicians and looking at 10,000 physicians around this country that are sober after 5 years, and of the 400 docs we treated, 10 walked in saying, help me. 390 walked in trying to save their ass. They weren't a bit interested in saving their soul. And yet we now have a recovery rate of 95% after 5 years, and we're following up 5 years later, and other states who have been able to have comparable structured programs after another 5 years show they're still showing 95% of those people still going to AA. And about 15% of those people who quit going. Between 10 and 15% of those people who quit going. Now, it takes about 2 to 3 years for those doctors to change to where they really begin to see this spiritual way of living is really worth it. Because when we had 2-year programs, we had a relapse rate of 60%. We found that there's 30 to 35% that relapse between 2 years and 5 years. And so we become their benevolent dictators. I won't do this in AA, but I'll sure as hell do it in the physician's recovery program. And you better hope I do a damn good job if you ever come to Kentucky. Because if you walk in your doctor's office, you don't know whether that doctor's got a pill or an alcohol problem or not. But you better hope we do. And if you want to tell me that I should not intervene and control their lives, then ask your neurosurgeon if he's had a drink or not. You know, one of my good friends went in to have heart surgery one day, and the doctor walked in. He said, "I've gone over all this with you." He said, "I really appreciate your history of alcoholism. Do you have any questions of me?" And he said, "Yeah. Have you had a drug screen today?" I thought that's funny as hell. I love that. I thought that was great. And the doctor looked at me and he started laughing. He said, "No, but I'll take one if you want me to." And he said, "No, I just thought I'd be cute." I thought, maybe you picked the wrong time. Be cute. Be cute after the surgery, right? Anyway, so this success rate is directly contingent on the commitment to the program. It's correctly contingent on the responsibility. Wilson said this program is spiritual. He didn't say it has a spiritual component. He says it's spiritual. 2 components, humility and responsibility. Humility and responsibility. It's very difficult to get goosed by the Holy Ghost if you don't get off your ass. Okay, it's really difficult. I won't say impossible, but I'll say virtually impossible. So spirituality requires a lot of work and a lot of commitment and showing up. It just doesn't happen out of the sky. This disease is a biopsychosocial disease We're going to look at each of those components, because to omit any of these components in the spiritual resolution it's just not going to work. Even if they don't drink, there's not going to be the quality of sobriety that we're going to see. Let's look at those in reverse order. Let's look at our society. We live in a society which not only condones drinking, it promotes it. Now, this talk is not against alcohol. The Jews call alcohol the gift of God that gladdens the hearts of men. And for 90% of the population, that's true. For 10% of the population, it's the kiss of death. Everybody knows that statistic. It still holds true. Still holds true. So we live in a society which not only condones drinking, it promotes it. Look at our advertising. Our advertising is not subliminal. Subliminal advertising says, first of all, subliminal advertising is illegal. Our current advertising says you're stupid, because we're going to show you a commercial that's so damn dumb that it's going to force you to, or going to encourage you to drink beer, and you're thinking, I'm not buying that, and yet you're drinking beer. In Kentucky, when UK plays basketball, no TV in Kentucky comes on without a bottle of beer in one hand and a bag of popcorn in the other. The TV doesn't work. Must be the truth, because that's the way everybody sits and watches Kentucky play basketball in Kentucky. The redneck joke's fit for Kentucky. I know, I am one. I'm a redneck. And my family tree only forks one time, you know, and that was somewhere in the 1700s. That's not really true. My eyes just got close because of my drinking. We live in a society which not only condones drinking, it promotes it. And let's look at it. Here's our commercial. And these play a big part. If they weren't being successful, the whiskey industry right now is getting ready to put millions of dollars in to try to combat the beer industry, which is whipping their butt because of advertising. Commercial. Here's these three guys coming down this gangplank. It's 3 o'clock in the morning. It's pitch black. The bottom of the ramp is a John boat. 6-pack of beer in there. All their decoys, all their camo outfit. They're obviously going goose hunting. And back up here in this cabin are these three beautiful women. Totally chauvinistic commercial. 3 in the morning. They're all waving goodbye to their men, and they're too dumb to talk. They just stand there waiting. And the guys say, it don't get no better than this. You know, and all the guys go, yeah. And my wife looked at that, and I'm a goose hunter, and she said, that's the dumbest commercial I've ever seen. I said, yeah, when I drank, I didn't hunt. When I hunted, I didn't drink. She said, no, if you think I'm going to stand there at 3 in the morning waving goodbye to you, you lost your time. And here is this good-looking 25-year-old girl with her arm around this gorgeous 25-year-old young man. It's a great commercial. They're moving away from the camera. In her hand is a cold black bottle of Cavassier. It says, are they going to have fun tonight? Women. Gorgeous woman. Typical 1990s type of woman. 6 foot tall, lean, cold black hair, gown down to her ankles, just gorgeous. City twinkles below her. She's in a 40-story penthouse apartment, and beside her's this long neck glass, and there's bubbles in the glass. Says, for the woman who can have everything. The most seductive show these 30 and 40 good-looking 20 and 25-year-old young men and women going out to this seaplane. They take a burlap, or it's burlap, and they take the burlap off. It's a seaplane. They go up and they land in this azure lagoon in the Bahamas. They come out. The guys all have a case of beer on their shoulders. That night it shows this gorgeous girl behind this sheet screen with a fire behind her, and her body is lithely dancing. Next day it shows her in the surf with a beer bottle in her hand. The seaplane's behind her. Perfect setting. It says they don't ever have to go back. What's the message? Life is good, but what makes it better? Drinking. Between 1982 and 1987 in Jefferson County, a population of 1 million, I must have talked to 50,000 school children between the 5th and 6th grade in high school, sharing my experience, strength, and hope with them. With the impact of being a physician, recovering alcoholic, with some idea about your eyes are blue, you inherited that, your hair is gray, or your hair is brown, you inherited that, and you will inherit this inability to drink like a normal person. So if you've got alcoholism, and they really bought it. The 5th and 6th graders loved it. And I related to them more, and I was talking to Casey. She said, yeah, I think it's because of your arrested emotional development. But the fact is, we do arrest emotionally. The minute we start drinking and drugging, that's when we quit growing. What is maturity? It's living through life's processes, adjusting to how to deal with them in a mature fashion. And if you're drinking and drugging every time you run into adversity, or even if you're having fun, as I did, you don't grow. I treated doctors who made it through medical school smoking dope from the time they were 14, and what they were highly trained technicians who could operate on your heart but didn't have the emotional stability to act any greater than a 14-year-old. One young man in particular, chief resident in family medicine, picked him up. They called him down, he's smoking dope, making rounds. I got him out there, we sent him off to 6 months of treatment. Treating a pothead is difficult. And this lecture is not against, isn't dealing specifically with marijuana, but I'll tell you, it's the worst drug we got on the streets today. It makes cocaine pale because of some of the impact of marijuana. And in another lecture, I don't know when the hell it'll be because it won't be back down here probably, but what we know about it today is incredible. We treated him, came back, got into NA, was doing fine. He's such a good doctor, we hired him. And when I quit practice, we had 17 docs and 5 offices. And I had him in one of those offices. He got married. His wife got pregnant. She called me one night and she said, I think Mark's using. And I said, why? And she said, well, he's not coming home till 2 or 3 in the morning. So I called Mark and I said, why aren't you going home? All these drug screens ran. I said, why aren't you going home? He said, oh, Burns, I've just been trying to get my records up. I said, get your ass home, be with your wife. She's pregnant. It's kind of like Richard said, you know, I ain't here to deal with you about trying to figure this out. Get your ass home and be with your wife because she's pregnant. She has the baby. She calls me back and she said, I'm sure Mark's using. I said, why? And she said, he's not coming home at all. Baby's about 3 weeks old. So he comes home, eats breakfast, changes his clothes, and goes to work. So I go down there that night, park there. Sure enough, I pull up in the driveway at 3 o'clock in the morning. His car's there, lights are all on. I go in, I can hear him back in the office. I'm expecting to see him with a needle or with a bottle or with a joint. And I walk in, and you know what he's doing? He's sitting there playing computer games. What do 14-year-olds do when they've got a new baby and new responsibilities and they never grew up? They do what 14-year-olds do. They play computer games. And this whole process of recovery and spirituality is maturity. It's growing up. About 3 years ago, I grew up. Honest to God. I'm sitting there and I think, I'm a grown-up. It was a wonderful feeling. It was a wonderful feeling. And people say, you know, take somebody like Richard or somebody like me, or I can go around the room, and if you're over 40 years old and you get up to the podium and you say, I can't wait to be what I'm going to be when I grow up, I'm going to say, give me a break. Jesus Christ, give me a break. Don't sit there and think that's cute. It's not cute. That means you're not even trying to work a program. This maturity comes as a result of working this program. When I start getting cute about it, like, I can't wait to be what I'm going to be when I grow up, you make me want to puke. You know, work your program and grow up. Instead of wandering around thinking it's neat to be arrested emotional development. But anyway, I relate to these 5th and 6-year-old kids. They called me down to see this little gal who was in the 5th grade. I walked in, and they trusted me, and I really trusted them. And I walked in, and everybody else, she looked at me and said, Dr. Brady, I'm glad you're here. Everybody else asked her where she got it. I said, why did you do it? And she said, because Sarah Jane, one of the other little girls in school, brought it to her and said, if you don't do this, you'll be all these 4-letter words we've all heard. Don't say if we're in good recovery, and sure don't want to be called. And she said, I don't want to be that. Don't ever underestimate the power of peer pressure. We use it very constructively in meetings. We use it very constructively in sponsor-pigeon relationships. Let me tell you, I did what my sponsor told me to do for the first 10 years of recovery because I wanted his approval. Then I finally grew up to know that I had to live on my own approval. But while he taught me how to grow up and shared with me many things, I did it for his approval. Don't ever minimize the power of peer pressure for those using and for those in recovery. It's absolutely one of the most important things. What do we say when people get sober? Run with the winners. Don't go in slippery places. Change playmates, playpens, and playthings. These are the societal components of drinking. When I get finished, you'll even have some idea how the brain chemistry changes when we go back in the bad environments. So society and the societal component of this, critical. If you want to be a winner, run with winners. If you don't want to slip, don't go in slippery places. The neat things that we say, and they really hold, change playmates, playpens, and playthings. It's not possible, what Sheila talked about last night, and Casey sponsored a young woman who came in much like you came in. And to see you today tells me you chose to run with change playmates, playpens and playthings as dramatically as anybody. As dramatically. And I really take my hat off to you, because I know that's not easy, especially when you're as young as you are, but it has to be done. You can't have a foot in one side of the world and a foot in the other. Can't work. Can't work if you're an alcoholic of my type. Let's look at the psychological components. Alcoholic personality. There is no such thing. All the reputable data tell us that when you say he has an alcoholic personality, I don't know what that means. There is no such thing. If you run MMPIs, which are tests for emotional stability, on us, you'll never find an emotional profile. You'll never find a normal one, but you won't find a consistent one. So there is no such thing as an alcoholic personality. Still used in a lot of the medical profession, doesn't hold water. Mental illness, there's no more mental illness in the alcoholic population there is in the normal population. Mental illness being bipolar disease, schizophrenia. Some of the literature talks about an increased incidence of bipolar disease. That's hogwash. It is not true. There's no more mental illness in the alcoholic population there is in the normal population, 3 to 8%. Bipolar disease, schizophrenia, and major psychotic depression. Now here's the hooker, and stay with me, because this is where we really get, this is where I got into some of the damnedest fights with the professionals you've ever seen. And I don't expect to get into any with y'all, except from those people who aren't listening with an open mind. The hooker in this is that 90% of alcoholics have significant affective disorders as a part of their disease of alcoholism. It's not alcoholism and affective. Now let me tell you what the affective disorders are. They're anxiety and depression. Simply stated, anxiety and depression. And it's not alcoholism with a secondary or axis 2 diagnosis of depression, or axis 1 even. Alcoholism or alcohol abuse or alcohol use disorder or alcohol dependency and major depression. No, the depression is a part of the disease of alcoholism. Bill Wilson. Spend the time to study this incredible man. God, if you don't believe God picks the most wounded soldiers to serve, then you need to study Bill Wilson's life and need to be grateful that he picked you. When he wanted a job done, and if you haven't read the Bible closely in years, read it. He always picked the wounded soldiers. But Bill Wilson was racked with this, the affective disorders. 90% of us have significant affective disorders, anxiety and depression, as a part of our primary illness of alcoholism. In most instances, it will be significant and precede the drinking. And therefore, when we drink and stop drinking, we've still got it. Now, the deal here is how are we going to treat it? And this is where you get into the dual diagnosis stuff that floats all around. And the fact is, if you don't treat their depression, they can't get sober. Or if you don't treat their anxiety, they'll drink again. Well, there are some people who do need treatment for their anxiety and depression. The critical call is who and how many and when. Who, how many, and when. And I will tell you that the two major studies done were done by Mark Schuckett at Scripps Institute, who has been one of the leading educators in the disease, especially in genetics, and by Mark Gold at the Brain Institute in Miami. Both these are psychiatrists. Neither of them are alcoholic. Both of them have been devoted to us for as long as I can remember and doing real solid research. And they have stated, separate studies, that 100% of alcoholics coming into treatment or coming into recovery are depressed. 60% will clear within 4 weeks just getting off of the drug, or the drug being alcohol. 60%. And another 32% will clear within 1 year learning a new way to live. That means you've got 92% clearing of their major depression and anxiety to the point that it's disabling by learning a new way to live and staying off the drug. That leaves 8% who are going to need medicine, as opposed to the 50 to 75% today who are on medication. Now, the critical deal is who decides who needs it and who doesn't. People like me, not just doctors, addiction specialists who have recovery and know recovery process. That's why it's best, not essential, but it's best to see a physician who is in recovery. I'm talking about an addiction specialist in recovery working a 12-step program, because all the studies are real clear. The number one treatment for alcoholism is AA. Multiple studies. The number one treatment, the number one mechanism of recovery is AA. And anything that's done in addition to that needs to be done by people who know exactly what they're doing. The last 5 years of my practice, I guess I saw every alcoholic in Jefferson County, million population, who wanted to stay sober because they knew I wouldn't give them the wrong medication. But they knew I'd get the right thing for them. And when these people would come into me, and I'm just sharing it with Lynn, when these people come in and would sit down with me, and if they were in that first 2 years, that gets real spooky. So you just had to figure out if they were able to pee in the right commode and zip their fly up, and if they were able to get to the right room, and if they literally were able, and that's kind of cutesy. But what I did want to know is, were they sleeping halfway decently, and could they get to work, and could they show up where they were supposed to show up on time, and were they going to their meetings, and did they have a sponsor? Now that's what I needed to know. Because if they were doing those things, then I would continue to see them usually at 2-week, 3-week, or 4-week intervals, so I could see if they were going to slip into their vegetative state. And if they were, then they got put on medicine. Because if they start getting vegetative, they deserve treatment because they're getting into some real tough stuff. And these people literally can stop eating, can stop sleeping, and can get in real trouble even trying to go to AA. Not many happen, but they can that first 2 years. After that, when the person would come in and sit down to me, I'd say, what are you doing with your recovery? Oh, I'm working my program. Tell me about your program. How many meetings are you going to? Well, I'm going to 3. How many were you going to a year ago? 6. You got a sponsor? Yeah. How often do you talk to the sponsor? Well, about once every month. How often were you seeing your sponsor, talking to him a year ago? Oh, I was seeing him at meetings every night, or seeing him at meetings 3 or 4 times a week, talking to him, frequently during the week. And if I'd go down, I would see they had moved away from what got them there. And the first thing I would do with these people is I'd say, you get a hold of your sponsor, and you have your sponsor in to see me in a week. You come in with your sponsor. Because number one, I wanted to find out if they had a sponsor. Number two, I wanted to find out if they had a sponsor that knew enough to piss in a tub. Because today in this population, what we've got are a whole bunch of people sponsoring people out of the sheer volume of numbers. And Richard was right on. Wilson, in his last major address, talked about 2 things. One was that anonymity was ever more essential to recovery, and the other was AA must and will change. And Richard's also right, is I don't think Wilson had a clue just exactly the dramatic impact that would have, but he knew that it would change. And he didn't say that was necessarily a bad thing. And when I first read that, I called a woman who'd been sober she died with 55 years sobriety. She had about 50 years sobriety at that time. And Geraldine D., actually she's dead, so her name was Geraldine Delaney, up in New Jersey. And I called Geraldine and I said, has AA changed since you came in? She said, yes. I said, how's it changed? She said, when I came in, there were 5 old-timers for every newcomer. She said, today, there are about 15 or 20 newcomers for every old-timer. So we got people with 1, 2, and 3 years of sobriety sponsoring people. And I got to tell you, that's scary. That is really scary. So I would have them bring their sponsor in. We would talk. I'd give them a set of Joe and Charlie's tapes, the big book of Alcoholics Anonymous, and say, you listen to every one of these tapes before you see me in a week. And they would come back in, and it worked out exactly right. About 92% of them just weren't working the program. And when they worked it, they did fine. When they applied it on a daily basis, the 12 steps, the whole deal. And while I agree with Richard that the whole program's the 12 steps, there are components to that, and he didn't say that it didn't. But I have this logarithm about the principles of recovery. When you're talking about spirituality, it's a triangle sitting on its point. The base is up here, and the point's right here sitting on a base. And if you want to know if your life's in balance or why you may feel like shit, go to the logarithm. On this corner, this upper left-hand corner is sponsor. This upper right-hand corner is meetings. This point that it's balanced on is the big book, which are the 12 steps. And it's sitting on a base of honesty and one day at a time. And if you want to know, and in essence, when you go to bed at night, if you do the 11-step prayer the way it's written, that's exactly what it's. Is there somebody I haven't talked to today? Who's that about? Could that be a sponsor? God knows it might be. Is there somebody I haven't made my amends to today? Have I been kind and loving toward all? Have I been self-centered, dishonest, resentful, or fearful? This is 12-step work. And you do that, and I'll guarantee you, every night when you go to bed, if you draw that and you look at it and you're feeling like crap, even if you're not feeling like crap, ask yourself. And 92% did fine. 8% would end up needing medicine. If they walked in and told me they were doing that whole drill, they got sent to a psychiatrist that afternoon, because these people needed medicine. And anybody in AA, unless you got a medical degree who wants to practice medicine, then you need to do your own inventory. I've sponsored at least 2 schizophrenics, and I had to sponsor them because they kept being told to get off their medicine by people in AA. Now, I also understand that a lot of people in AA have a real strong aversion to physicians because there's a lot of ignorance out there. And part of the job of that people like me have taken on is educating doctors. And we're doing it. Not as rapidly as I'd like, but nothing happens as rapidly as I'd like. But we're doing it. But part of my message is quit practicing medicine. Share your experience, strength, and hope, and get people, if you got a pigeon that you think needs medical help, get them to somebody like me and let them make that decision, and you share your experience, strength, and hope. Affective disorders. Affective disorders are divided into their anxiety and depression. The anxiety is divided into obsessive compulsive disorders, agoraphobic disorders, panic disorders, and post-traumatic stress disorders. We have found that in our homeless shelter, where we have this running rampant, we don't have to deal with the affective disorders, with one exception. The panic stuff, the agoraphobic stuff, the OCD stuff, in almost no instance do we have to deal with that in the first 2 years. The one we do have to deal with is post-traumatic stress disorder associated with child abuse in women. I've done at least 200 fifth steps in that men's homeless shelter. Sat with some of those guys that are big enough to eat that wall in my lap, stroking the back of their hair while they talked about being abused as a child. Most men will not relapse over being abused, sexually abused as a child. They get aggressive and they want to fight everything. Anger is incredible. The women invariably relapse, unless there is some parallel track to teaching them their recovery process and letting them look at that in the 12-step modality. You put most people into any sort of deal like that too early, they'll relapse over the pain. But the women have to look at it. And our experience now is close with the men. We've had close to experience with 10,000 men. With the women, we started that program later, and our experience is running closer to about 1,000 to 1,500. But I'm telling you, it's consistent across the board. Other consistency. 85% of the women's drug of choice was cocaine. 85% of the men's drug of choice was alcohol. These are street women and street men. Now remember, if you think about that, that's not hard to understand. These women are being controlled by their pimps and johns with cocaine. And a woman can be homeless living in a house. So we thought we'll change the program. It didn't work. The men with their alcohol problem, they didn't make any sense for about 6 months, but we could get them in there and just rote teach them, because all they do for 6 months is read the big book all day and study it just like a textbook and go to meetings at night. That's what they do. And the women could get it quicker with cocaine as their drug of choice. They just didn't remember it any better. So we went back to our 6 months format for both the women and the men. For both the women and the men. But we didn't have to deal with any of those affective disorders except post-traumatic stress disorder in the women. Depression, primary, basically what you see in there is, we're not talking about bipolar stuff. That's a whole different animal. I would say at least 75% of those men were diagnosed as bipolar. My job is to review what their diagnosis was when they came in and the medicine they're on. They're not bipolar. They're just very typical drunks who act like bipolars. And you get them off their medicine, they're not bipolar. They are not bipolar. But leaving out bipolar illness, endogenous and exogenous depression, if there's a strong family history of depression, in all probability you are dealing with an endogenous depression. I don't know if it'll need medication. That's not my point. My point is that you'll have to recognize that, and the spiritual program will work. But in all probability, you'll need to be in touch with a physician who understands that, or a sponsor who's sensitive to it. Camille's very sensitive to this. very sensitive to this. And I mean, I remember Camille 10 years ago when she was a rock-carrying atheist about anything like this, and today she's not at all, because she sees the difference. And this is somebody that is my wife's sponsor, and somebody Sheila knows very well, who's got about 26 years of sobriety, and she was a black belt AA member who had more aggression than she had sense for a long time, but now she's got both because she's got some information, and she's really doing a hell of a job. Other thing that needs to be looked at, ADD, that's attention deficit disorder. 90% of male alcoholics will have hyperactivity or attention deficit disorder. 90%. The original history on hyperactive children was it came on at birth, burned out at the end of teenage years, and was over, and was related to a dopamine deficiency, which is a neurotransmitter. Okay? That's why we gave Ritalin, because Ritalin works to increase dopamine in the brain. We found that it goes on into adulthood in 90% of males, alcoholics, and it's called ADHD or ADD residual type. My home group's a men's meeting, and I love to sit in this men's meeting because I love men. I love men. I'm female dominated, but I'm male oriented, and that's exactly the way I've always been. One of these guys who likes to hunt geese and come home and make love all night. Fortunately, I'm changing my partners in between there. I guess I'd do it in a duck blind if I had to, but in any event, that's the way it goes. But when I'm sitting in that men's meeting, I'm sitting in a meeting with a whole bunch of lab rats. I watch them, bank presidents, street people, doctors, lawyers, GE workers, the whole bit. And the one common thing they have is they're all hyperactive. Did you see Richard today? Richard's a solid member of recovery, but this is an ADHD. Whether he likes it or not, that's what he is. You hear me and watch me and listen to me tonight, you're looking at an ADHD. And those of you in this room that I know, by God, you are too. Now, you may not be to the point where you're dysfunctional, but I mean there's an energy level in you which is real clear, and it's this way: irritable, restless, and discontented. And that's when you're on your best day. You know? That's what Silkworth said when he said irritable, restless, and discontented. One of the things he's looking at a form of ADHD, and 40% of women have it. Part of this study on women and genetics and alcoholism is looking at ADHD in women, because all the young ones are, no question, this one is, you probably were. You know, and Libby absolutely is. I mean, my daughter Libby, who talked here last year, some of y'all may remember, but she talked here last year, and Libby's 37, been in AA I think 17 years, 16 or 17 years, something like that. I've got a son, 31, who's been in AA for 14 years. I mean, hell, if you're a Brady and you walk past the bar, you go to your first AA meeting on the next corner, hell, that's just all the way it is. And we'll get into the genetics of it here in just a minute. But ADHD, residual type, and we have to look at that. The question is, do they need medicine? My drug of choice was amphetamine for the first 12 years. I took it to study. I stayed on it because it allowed me to focus. Now, I can't read for longer than 15 minutes at a time. That's the best my concentration will do. But I've got tapes I listen to, or used to, I don't so much anymore, but used to listen to all the time. Tape library is incredible to deal with my ADHD. But give me medicine, the typical medicine of speed drugs, why don't you just get a gun and shoot me right between the eyes? There are other drugs that can be used if it's severe enough, but it takes someone like me to make that call. Is it severe enough? And I've made it with alcoholics that absolutely needed to be on medication because of their ADHD in their so-called residual or adult form. But this irritable, restless, discontented has many components. It's very real. ADHD residual type. Getlow and Henneke met with they had about 75 to 100 alcoholics they worked with in the middle 70s. Henneke's a clinical psychologist, Getlow's an addictionist. Henneke came back to Getlow and she said, I found that every one of these alcoholics has a poor identification with a parent of the same sex. Getlow, who thinks that Freud is a cuss word, went back and reviewed all of his charts since 1953. Presented a paper in 1979 to 1,800 therapists and people who are in this field. I was there with 1 year of sobriety. I wasn't in this field, but I was interested in what they were talking about. And he said to us, I'm telling you, it's true. And I'm sitting there thinking, damn, I'm having a hard time buying that. I said, my daddy's one of the neatest people I've ever known. And he was. My daddy was one of the neatest people I've ever known. I said, I'm having a hard time buying that. And so I went up to Dr. Getlow after it's over, and I said, Dr. Getlow, please help me with this. My daddy is one of the neatest people I've ever known. He said, tell me your story. Well, I was born very poor. My daddy always had 2 jobs. He went to work in the morning before I got up, and he came home at night after I went to bed. For the first 10 years of my life, my mother raised me. Most of my communication skills and interpersonal skills are female. That's what made me an outstanding primary care doctor, because the best primary care doctors are women. I know I worked with 17 doctors, and one of them was a woman, and she was the best doctor we had. She couldn't diagnose better, she couldn't write better scripts, but she would listen, and she would nurture, and she would seek, and she would make the patient feel like that they had dignity. Most of the male doctors would pop in and pop out and do the next one. It was a job. And I was the second best doctor we had because most of my skills were female. I'm a nurturer, I'm a caretaker, and that's exactly what I am. My male skills came out of locker rooms and bad books because my daddy wasn't there. I remember when I was 4 years old, he took me to my first football game, and at halftime we went in to the restroom, and I sat down on the commode, and Daddy looked at me, he said, Burns Mac, what are you doing? I said, I'm peeing. He said, why don't you use that, and pointed to the latrine. I'd never seen a latrine. Who took me to public restrooms? My mother. And she took me to the women's restroom. So I'd never seen a latrine. And Daddy said, I'm going to have to start taking you to more football games. But the take-home message is, where do we learn our coping skills? We learn them from emulating people of the same sex. Big brothers and big sisters, what's the deal? We take a responsible adult male and put him with a male child, and that male child learns to emulate that male. What do we do when we bring them into AA? Get a sponsor. You get him as a sponsor. You don't get her as a sponsor. Well, why? Well, what we've already said, because you'll end up sleeping with her. Well, that's a big risk, I grant you. And frankly, it is a real big risk. But the real reason is so you can learn to grow up. So you can follow this man, so you can get with Richard and he can teach you how to grow up. You're grown up, you're a man, you can probably whip his ass. But the bottom line is, you don't know how to grow up. He's going to teach you. That's what a sponsor's role is. That's exactly what it is. And people say, well, I get a female sponsor. A male says, I get a female sponsor. I'm not going to sit in judgment of that. I'm going to give you the facts. You draw your own conclusions. And there may be circumstances where that's appropriate. They're rare. My first sponsor taught me early on, when you learn to relate to the people of your own kind, you got a better chance to recover. The women will manipulate the men, and the men will manipulate the women. But damn it, it's hard for men to manipulate men, and it's hard for women to manipulate women. And we come in conning. And we got a game to play. And if you got a skirt on, I think I got about 2 legs up and got you hiked up 1 second before you know I'm there. And you ask me if I think that's the agenda? I don't think it is. That's just the way it always turns out. And 15 years in recovery, and I'll talk about it tonight, I was still playing that same game and didn't know it. You get with your own kind, you run with your own kind, because you're learning how to grow up, emulating people of the same sex. Psychological component of alcoholism. Now let's look at the biological. We're going to look at the genetics and the biochemistry. The genetics. The most compelling evidence we have today that this is a disease continues to be the genetic evidence. Between 1980 and 1990, there were 300 studies and 700 papers written in this country stating irrefutably the number, and that's been even doubled since then in the 90s, that the number one thing that is most compelling to indicate if a child will be an alcoholic is, does that child have alcoholic kinfolks? Kenneth Bloom at the University of Texas, 11th chromosome. He published in the New England Journal of Medicine. He'd found this is a technical piece of language, but he'd found a gene allele for dopamine that was present in 77% of alcoholics on the 11th chromosome, absent in 72% of non-alcoholics. Subsequent studies have shown that is not necessarily true. I've talked to Kenneth Bloom, and he said, Burns, it's true. I don't know what it means, but it's being studied in the genetics, that $50 million study on the genetics. What we have known between 1935 and 1950 in 3 different Scandinavian countries, There were 2,000 adoptee studies and 500 concordant twin studies. Some of the later studies have shown there may have been as high as 8,000 adoptee studies, and irrefutably, no one has ever questioned the validity of these studies. There's some question about whether or not they would conform to the ethics, because they put non-alcohol, they split up twin babies and put one in a known alcoholic home and one in a known non-alcoholic home. So there's been a lot of question about the ethics, but no one's ever refuted the validity of these studies. And what they proved conclusively is that if a child has a primary care relative that's an alcoholic, the chances of that child being an alcoholic are 4 times greater than the normal population, whether that child's raised in that home or not. You hear that? This is nature over nurture. David Ohms in St. Louis, who is a psychiatrist who's been treating us for about 35 years, said if one parent's an alcoholic, the chances of that child being an alcoholic are 45%. If both parents are alcoholic, the chances of that child being an alcoholic, 94%. Whether that child's raised in that home or not. Whether that child's raised in that home or not. C. Robert Cloninger in St. Louis defined 2 forms of genetic alcoholism. One are so-called type 2 are highly heritable, and type 1 are milieu limited. Type 2 is the adolescent alcoholism. These kids are literally alcoholic almost from their first drink. Richard described to you today a typical type 2 alcoholic. And early AA said they didn't exist. And he will remember when he first came in, probably, if he came in and they accepted him right up front, he was fortunate. Because around this country at that time, if you came in and you were his age, you were told to go out and drink more because you weren't ready. And we have a lot of old-timers, or a lot of people who are older in age with some of these so-called brats coming in. And they're saying these kids aren't alcoholic. Yes, they are. My kids were alcoholic by the time they were 12. They were screaming drunks by the time they were 12 years old. I've treated a 7.5-year-old alcoholic. And the characteristic of that alcoholic is these kids will be almost alcoholic from the first drink. They do not lose the ability to control the amount they drink. They may not drink that often. They may not drink that much. But when they drink, they immediately lose all forms of appropriate societal behavior. They become little animals. And that's what we see when these kids come into our meetings. I used to call them the little starlings. I said they fly in, shit, and fly out. But I'll tell you what they did. They really stuck to us, and we invited them in. Part of it was because of me and my kids. Part of it was the same affinity that this group had. And these kids, we had a cadre of them and this was in the late 70s that came in to us. 14, 15, 16, and 17-year-olds that came into our meetings. And some of them have now grown up to be incredibly, wonderfully responsible people. But they did not lose the ability to control the amount they drank. But when they drank, they just behaved bizarrely. Sheila described it last night. Bizarrely. And there's the literature is full of a definition of male alcoholics that are called antisocial. The young ones? No, they're not. They're type 2, highly heritable male dominant. That's seen 9 times more frequently in male alcoholics in males with male alcoholic, with their father being alcoholic, 4 times more frequently in the females. When we get them into that homeless shelter, dry them out, teach them the big book, they become pussycats. Most of them have been in prison. The common denominator for those men I've done those 5th steps with is they were all drinking before they were 10, and they were all sexually molested as children. Now, I don't know what to make of the second one, but I know damn well what to make of the first one. Because I expected them to behave that way. We're going to rewrite the textbooks. These are not antisocial personality disorders. They're type 2 adolescent alcoholics. The treatment is different. These kids, if we can do it, need to be put in some sort of alcohol and drug-free environment for a minimum of 2 years. Now, it's difficult to do that with our insurance the way it is, but and the only place they can even come close to duplicating that environment is where? AA. And they run in packs. And I love it when they run in packs because we don't have to take them to the woodshed. They take each other to the woodshed. You'll see one of them come in, he's had a drink, and then they'll all disappear for about 15 minutes. And he comes back and he looks like God has just entered into his life, you know? You know what I'm talking about, that God has just entered into his life. And we don't have to say a word. First time I ever saw, we were down in Atlanta, 1,800 people. I went for 9 years to this conference. And they had 4 of these young kids. The oldest was 19, the youngest was 15. The least amount of recovery was 3 years. And they were sitting up there talking to us. And somebody said, what kind of meetings do y'all go to? And everyone went around and said it. We go to at least one meeting for just us, the kids. That's so we can play. Said we go to the rest of the meetings with y'all so y'all can teach us how to be grown-ups and how to live. And I just started crying because I saw the truth, the role model truth, and what these kids are begging for, what they're begging for. Type 1, milieu limited. That's the adult form that Silkworth talked, that Jelnick talked about. 7.5-year mean average. That's the, this is the adult form. Starts in the 2nd, 3rd, 4th decade, can go to the end of life. Usually 60% more in women, usually related to a societal event, loss of a loved one, breaking up of a marriage, child dies, something like that. And they'll start to drink in 7.5 years of drinking, and they reach full-blown alcoholism. These people lose the ability to control the amount they drink. But they will stay societally responsible until they can't do it any longer. Quart of whiskey a night, but I never drank in my office. Richard crossed the line. He drank and went to work. He drank and went to work. He would preserve that until he could no longer preserve it. And the day that I put the shotgun in my mouth, I couldn't either. Treatment. Number 1, treatment's AA. Sometimes detoxification is necessary. We know that 15% of people who quit drinking abruptly will go into DTs. 15% of those people will die. 85% don't need medical detox. It takes a professional to know how or why. The blood platelet. If I cut myself, there are about 11 steps to clotting. One of those has to do with a component called a platelet. If we take the blood platelet of an alcoholic, subject that blood platelet to alcohol, we'll see these 3 enzymatic processes screwed up. We take the blood platelet of an offspring of an alcoholic that's never had a drink, subject that to alcohol, we'll see that same screw up in 10% of the cases. Again, further evidence of the genetics of alcoholism. This will probably be a screening test that'll be available. Whether we'll ever be able to use it or not, it'll take at least 30 more years to withstand scrutiny. Stimulus augmentation. Getlow and Henneke found out 2 things. They said, number 1, there's a poor identification of the parent of the same sex. Number 2 is all alcoholics are stimulus augmenters. Irritable, restless, discontented. We blow everything out of proportion. Brain waves. When we run brain waves on alcoholics, in a statistically significant number of cases, there's a screw up of 2 types of brain waves, the P3 and the low amplitude alpha waves. These are the brain waves that have to do with the cognitive ability to process stress, i.e. affective mood disorders, i.e. irritable, restless, discontented. In 1984, stay with me on this because it's going to get some really good stuff's coming. In 1984, Mark Shuckett took 200 Southern California college students. These kids weren't alcoholic. He put a brainwave on them, and his agenda was to get them drunk, and he was going to have a sound to go beep, 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 boop, beep, boop, beep, 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 boop, beep, boop. And he wanted to see how drunk they had to get before they couldn't tell the difference in the beeps and the boops. Okay? So we got started. Now, the P300 brainwave is a brainwave that we use today in medicine to give us a preliminary diagnosis of multiple sclerosis. That's what we use it for in medicine. We know it has to do with the ability to process stress. So he gets these kids going, and I asked Mark one time, why did he do the brainwave study? He said, I don't know. He said, because that really wasn't what I was looking for, but I just hooked them up. So he got them in there, and they're going beep, 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 boop, beep, 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 boop. And boy, they get drunker than the Lord, but they can still pop that beeps and boops right on target. But 10% of them lost their P300 wave. Then they took those kids and they did a full history on them, and that group of kids, 10% of them had primary relatives that were alcoholic. The other 90% didn't. Then they went and got another 200. They did their family history first. Wired them up, started doing the same thing, same deal. 10% of them lost their P300, opened up their family histories. They had a primary history of alcoholism. Then he went back and got the original group, brought them back and said, we're going to do this all over again. They said, okay. Wired them up and got ready and gave them a glass of 7-Up and lipped the glass with alcohol. And the minute those kids took that drink and smelled the alcohol, their P300 disappeared. Now let me think about what that's significance. We've always thought that the craving starts after the first drink. It starts at the memory of the first drink. You see what I'm talking about? Don't go into a bar to buy your cigarettes. Don't smoke if you can keep from it, but if you have to, and I won't get into that now, but if you ever ask me any questions, I will. But if you're going to smoke, don't go into a bar to buy your cigarettes. If you used to go to country western concerts to drink, don't go to country western concerts, because the minute you walk in, your brain starts its electrical activity. With our anesthesiologist, whose primary drug is a very powerful narcotic, we don't even let them back in the operating room for 2 years, because we can measure their pulse rate, their blood pressure, and the sodium chloride content of their sweat just walking in the room for at least 2 years, just seeing the drug sitting on the counter. Gedlow says, he asked every alcoholic, why do you drink? Some of us say we drink because we like the way it tastes. Everyone will say we drink because we like the way it makes us feel. He said, what we have to find out is, what do they feel like before they drink? Obviously, there's a payoff. You take a normal person, let them drink, they get a certain feeling, they quit. We drink, we'll drink and die, either getting the feeling or looking for it. He said, what we have to find out is, what do they feel like before they drink? In, let me see, how did it? Yeah. No. Damn, I just went blank. This was the work done in UK. Damn. I can't believe that. I must be getting old. You like that? Of course you would, wouldn't you? I'm not going to talk about you being fat. I'm not even going to bring it up anymore. And you just had to make me do it. I didn't want to. No, it had to do with the morphine. When they started the morphine studies that they did, and I just confused them with the marijuana studies that were done at UK in the early 60s. This was back in the middle 70s when they were doing the morphine studies. No, that's not what it is. I can't believe that. Okay. Now, all right, in 1975, I'll stop here. I'll go back and get the Western letter. Probably won't get it while I'm in this lifetime. But in 1975, there were a series of studies that were done, and they would inject human beings with morphine. And they would Geiger count the brain. And when the Geiger counted the brain, they found that morphine that was shot into the humans went to receptor sites in the brain. The conclusion was that if there were receptor sites in the brain for morphine given in a shot, then the brain must make a compound identical to morphine. Because if you got a receptor site for it, then you don't have boat docks without boats. So they started a whole series of studies, and they found the brain's own endogenous morphine. And that endogenous morphine is called beta endorphin. You've heard of beta endorphin. Beta endorphin is the runner's high. The runner runs and runs, and all of a sudden can't go any further. They've hit a wall, and then they just float. You take a normal person, put them in a dentist chair, and start grinding on their teeth with no anesthesia. In a little while, they'll be able to tolerate it because they're making the endorphin. One of the leading producers of endorphin is orgasm. That's why early on in sobriety we keep the men and women apart, because they really are getting relief from having an orgasm because their brain chemistry is being re-equilibrated. We have proved conclusively on studies done in alcoholic animals and in humans that the alcoholic animal and human is deficient in beta endorphin. And the offspring of those alcoholic humans and animals is deficient in beta endorphin because of genetics. That's the first feel-good compound that we are deficient in. Second feel-good compound was methionine enkephalin, another neurotransmitter, the second major morphine-like substance, and alcoholic animals and humans are deficient in it, and the offspring are deficient. Second feel-good compound. T.K. Lee at the University of Indiana, studying the neurotransmitters in a particular area of the brain called serotonin, noradrenaline, dopamine. This is what you know from Prozac, Zoloft, and Paxil. They increase serotonin. Dopamine is what's increased by cocaine and Ritalin and amphetamine. So he was studying this particular area of the brain in regard to these two compounds. And he found conclusively that he had a whole bunch of rats over in a cage. And rats will not drink alcohol. You have to breed special strains of rats to drink alcohol. So he had these rats over in this cage. Now, the way they ran this experiment is they ran a double lumen catheter almost microscopic, underneath this big muscle in the neck called the trapezius, up into the brain under CAT scan technique, and they'd put it wherever they wanted to put it. They would inject a certain chemical, draw back on the other side, and find out what that chemical will do. So they had these rats over here in a cage. It's a darkened cage. They had a lighted conduit over to the lighted cage. 10% of these rats come over into this lighted cage. He called these risk-taking rats. He called these non-risk-taking rats. And when he measured the serotonin and dopamine on these non-risk-taking, non-drinking rats, their dopamine and serotonin was normal. He measured this risk-taking rats. Now, these rats will drink alcohol. They'll drink water, they'll drink alcohol. Whatever's there, they'll drink it. These rats won't drink it, even if they'll literally die of dehydration, not drink alcohol. These rats will drink whatever you got. Their dopamine and serotonin was not as concentrated as these rats. And when they drank, it went back to normal. Now, he bred these rats, and he's got himself an alcoholic rat. This rat's looking for a bar, looking for a fight, looking for a woman. I mean, this is an alcoholic rat. I mean, this rat wants a drink, you know. And these rats had almost no serotonin or dopamine, and when they drank, it went completely off the page. Went completely off the page. Now, he got these rats, and the way they did it, they'd have a light up here, and they got that little thing in their brain, and they got a pedal down here. And when the light comes on, the rat knows if he hits this pedal, down will come the booze, and he'd drink the booze and go boom, pass out. Get drunk, pass out. I mean, here'd be showtime. He'd hit the pedal, and down it would come, and he'd drink it, pass out. So they finally got the idea. They put on the light, they ran 7-Up down in there. The rat hits the pedal, gets 7-Up, drinks the 7-Up, passes out for 2 weeks. And then he realized they screwed him. That's exactly right. And then he won't touch it. And what they had done, what T.K. Lee had done, had put the chemistry changes in the brain with the electrical mechanism in the brain, which shows that craving is related to euphoric recall, the thinking of the drink. But let's also look at what we've looked at. What is the alcoholic looking for? Relief. Deficient in beta endorphin. Deficient in methionine and enkephalin. Deficient in dopamine and serotonin, the 4 major feel-good compounds in the brain, and we're running 2 sandwiches short of a picnic and 2 quarts low. You know, why are we irritable, restless, discontented? Because by God, the world is, the noise normal people hear is, you know what you and I hear? Just like that every damn minute. That's just it. Every minute, here we are, red alert. And I never knew it was that way till I took my first amphetamine, and I thought, son of a bitch, they shut the noise off. The world got just completely quiet. And how many times have you taken that drink when you come in, at least when you got, before you became addicted, and you sit down and took that first drink? What happened? You got quiet. You got quiet. Never, the obsession to drink is for relief. And we are not like normal people. We are irritable, restless, discontented because we are lacking under genetic predisposition the chemicals that allow us to calm down. And we drink and we bring them back to normal. And then the problem, because of the rest of it, which is still to be defined, and that is, how do we metabolize the alcohol once it gets in? Now we will look at the compulsion. We've looked at the obsession. Now look at the compulsion. Alcohol is metabolized to acetaldehyde, to acetic acid, to CO2 and water. The female alcoholic, the big book describes the female alcoholic as being ripped much more severely, much more quickly physically. Medical science has also defined that. The reason is because since I prepared this overhead, we have found that the female alcoholic is deficient in the stomach lining in a compound called alcohol dehydrogenase, which breaks down alcohol into acetaldehyde in the stomach, even before it gets to the liver. And the female alcoholic lacks that. So the female alcoholic is getting the first 3 passes of metabolism of high-octane alcohol. And that's why a 30-year-old female alcoholic will look about 10 years older than a 30-year-old male alcoholic, because she's getting ripped much more severely, quicker, physically. Much more severely. And you take what she does like that, then she gets much more severely ripped emotionally. And the mess of cleaning up the young female alcoholic is almost gargantuan. If it weren't for God's grace and the program of Alcoholics Anonymous, I don't think one single female would ever get sober if they become alcoholic before they're 20. because the devastation physically and emotionally is incredible. And it's related to a great extent on the devastation of the chemistry of the alcoholism in the female. All alcoholics under genetic predisposition are deficient in acetaldehyde dehydrogenase. That's what breaks acetaldehyde down into acetic acid. This is where hangovers occur. This is where antabuse works. Antabuse will tie up with acetaldehyde and can produce death. There is virtually no place in the treatment of alcoholism for antabuse. I've given antabuse to 3 people in 15 years. The whole principle of antabuse, but these are the people who are so obsessive, compulsive, and impulsive, usually with ADD and OCD, and they are so obsessive, compulsive, and so impulsive that they will drink because they just cannot not drink. I'm talking about, I had one guy that he every evening he'd come in and pour himself a shot, only take 1 sip, and sit down and start crying and call me. Finally, I put him on antabuse, scared the hell out of him for about 2 months, and then I took him off it, and he was fine. He was fine. Virtually no place in the treatment of alcoholism for antabuse, and the reason is because the principle of antabuse is to frighten the alcoholic into not drinking. You can't frighten us. We were born frightened. The minute we hit the delivery room floor, we were scared to death, and I just explained to you why. The noise is too damn loud. What does it say in the family effort? Alcoholics are sensitive people. You read that? It takes some of us a long time to outgrow it. Wilson was talking about the spiritual growth to overcome the innate sensitivity of a too loud world. So you give us antabuse to scare us into not drinking? I've never seen one single person on antabuse, if they wanted to drink, not figure out how to drink around it. You can drink around antabuse. You just got to figure out how to do it. If it doesn't kill you first, you got to figure out how to do it. And you can. And I will never keep anybody on antabuse longer than a couple of months while I integrate them into the program. If they're not ready to buy the program, then I take them off the antabuse because they're not ready to quit drinking. If they're not ready to quit drinking, I can't be a doctor. There are consequences. If I don't have a doctor, I'm working as a sponsor. I say, as you said, I won't leave you, but I got not much else to give you until you're ready to quit drinking. Then I'll give you everything I got. There's a side chain here. When acetaldehyde the concentration becomes so great, then there's a side chain called dopaldehyde. Now that's important. In the early 1970s, there was a brilliant researcher named Virginia Davis. She did an experiment, which is a valid experiment. She took a rat, as I told you, they're alcohol avoidant. She put a plate of alcohol and a plate of water. She took this rat, and she had been looking at a group of compounds called tetrahydroisoquinones. They're metabolites of morphine and morphine-like substances. And she took this rat, and she injected this rat's brain with THIQ. And that same rat that wouldn't touch the alcohol, then went directly over and drank the alcohol till it died. Now, these studies have been duplicated a number of times, and they're valid. She said, I've made an alcoholic animal. I wonder if that happens in humans. 17 years later, she published her paper saying that she had found that if she reacted dopamine, which is a neurotransmitter, with acetaldehyde, you saw where we got that, she produced a compound called salsolinol. That's THIQ. She injected that into the animal's brain, nothing happened. Then she reacted serotonin with acetaldehyde and got tetrahydrobeta-carboline. That's a THIQ. Into the animal's brain, nothing happened. Then she actually discovered the side chain of dopaldehyde that I showed you. She reacted dopamine with dopaldehyde, produced a compound called tetrahydropapaverine. Postmortem studies on alcoholic humans, their brains, and alcoholic rats, their brains, showed that the concentration in her presentation was 1,200 times greater than in the normal population. She said, I've discovered the etiology of the compulsion, the addiction to drink. Approximately 50 laboratories have looked at this since 1987. And this was taught, some of you may remember this being taught in the middle and early 80s as the cause of compulsive drinking. These 50 laboratories are equally divided. 25 of them say it doesn't exist. 25 of them say that it absolutely does. And both groups are entirely reputable. This is part of the $50 million study. When I talk to you about aldehyde condensation products, that's what these are, THIQ. This is almost certainly where the compulsion to drink does exist. It's almost certainly where the progressive nature of alcoholism lies. But that's still up for grabs. 5 years from now, if I'm still alive and you're still alive and we're both sober and God willing, all that'll happen, then maybe we'll know where THIQ stands, and I'll come back and give you another lecture. But we do know that basically that it plays a part in the compulsion to drink. We've looked at an alcoholic, individual born into a world that's too loud, looking for relief. In this environment which says it's better to drink, drinks for that relief and finds it, and the brain starts a whole screwed up mechanism of metabolism, and you got an alcoholic. Loose lattice work, absolutely scientifically sound. More will be added later, but I'll tell you what, if you don't have some insight right now into the fact that you are different, bodily and mentally, then you haven't been listening. When we call this a disease, it is well-founded. You don't have to defend it. If somebody says, I don't believe you got a disease, you can believe whatever you damn well please. When you get ready to do enough research that I've done, then I'll talk to you. If you want to give me your opinion, it's kind of like buttholes. Everybody's got one. I don't pay much attention to either one of them, you know. That's the way I feel about it. When you got information, we'll talk. Until you got it, you can talk to somebody else. Don't talk to me. So we can talk apples and apples. Now, this is a critical part of recovery. The post-acute or prolonged recovery syndrome. Wilson defined it in 1935. He actually wrote about it in 1938 when he said that for a year and a half he couldn't get a job because he was racked with waves of self-pity and resentment. He was defining the first 2 years of recovery. And nobody wanted it any more than Wilson, but he was saying he was racked with waves of self-pity and resentment. In 1979, it was reported after an intensive study that the power of retentive memory for recent events will be screwed up for 6 months to 2 years. Sleep patterns screwed up 6 months to 2 years. Remember when you used to go in, old-timers, and say, I can't sleep, and they'd say, hell, nobody ever died from lack of sleep. I'd think, they're insensitive. But by God, it's true. Nobody ever does. But nobody ever sleeps right. I don't know how many people come in and say, Doc, please give me something for sleep. Okay, drink a glass of milk and call your sponsor. And that'll cost you $19. I really never charged them for that, but I might charge them $5 because they had to be responsible. But, you know. But it's true. And retentive memory for recent events, I lost my car drinking. All the time. I lost my car sober for 2 years. Those of you who've heard my story have heard that. I mean, I'd lose it. I lost it one time in an 11-space parking lot next to my office. Went out and said, where's my car? I'd driven Casey's car to work and walked out and I couldn't find my car. Went and got my partner and started crying. I said, somebody stole my car. He went out and said, Burns, you drove Casey's car. And I said, that's right, I forgot. So he assigned me a parking spot, an 11-place parking space. And he said, when Burns leaves the office, he's going to that parking space. And if he get whatever's in it started, he's going to drive it home. And that was it. How many times have you, and I would get up in the morning and read the Curry Journal and couldn't remember it. I would take my meditation book and read it and think it was beautiful and close it and couldn't remember it. I thought I had messed up my brain. This was in 78. This wasn't known until 79. And when I read this, I just cried with relief. If you can find your way into this motel, even if you can't remember whether you drove your car or not, I promise you if you're in the first 2 years of recovery, you're going to be okay. Because the wet brain syndrome, which only encompasses 2% of alcoholics, the Wernicke-Korsakoff psychosis, you couldn't find this room. If you can find it, you're going to be okay. Just keep coming back and trust me, you're going to be okay. And I did this talk in Bull Shoals, Arkansas one time, and I said, you'll be okay. There was a guy sitting back about where y'all are in front of that column. This guy had this little hat pulled down over his eyes, looked like he was going to shoot me or hug me when you got through. And when I said that, he jumped up and said, hallelujah, thank God, I thought I'd lost my mind. And I mean, for that whole weekend, he followed me everywhere. And if I said shit, he wrote it down because he thought he had seen the Lord, you know, that I had brought him the message. Simple problem solving and stress management. Look at those two. Those are living skills. Every day, simple problem solving. Every day is stress management. And if that's screwed up for 2 years, you wonder why you're slapping hell out of somebody at a parking lot? You wonder why you can't figure out which bill to pay first? You realize when you can't really figure out when you go to the grocery what you're supposed to get?
Or if you washed something or didn't wash something, or where did I leave that suit or didn't leave that suit? Now, if you're my age and do that, you probably got some real problems. Probably got Alzheimer's, but the same, or at least pre-senile psychosis. But if you're early in recovery, this is going to happen. And during that time, that's why we don't make a dual diagnosis in the first 2 years, because we look like everything. For 2 years, we look like everything. I mean, you can't separate the fly manure from the pepper, because we look like everything. Just stay with us. 60% of relapses will occur within the first year, conservatively, because you lose hope and think you screwed up your brain. You'll be okay. Treatment, short-term, detox, non-medical if you got people who know what they're doing. If you don't, you really need medical detox. And this is where a rehab center, and let's go back. If you recall, Wilson was detoxed a number of times. He wasn't in a rehab center, but he certainly went through detox. And 15% of people, as I said, who quit drinking abruptly will go into DTs, and 15% of those people will die. I even teach my doctors that if they're working in a med-surg hospital, to medically detox everybody, because you don't have personnel to know when you're starting to go sour. In our facility, we've got pros sitting right beside the bed. You know who those pros are? People who've come through our program with more than 2 years of sobriety, who have come from the streets. And they sit on the bed with those people when they're non-medically detoxing and talk them through detox. And the minute they start to go sour, we've got an immediate hookup with EMS, and we shoot them right down to University Hospital, and they go through medical detox. We've saved the city so much money that they're trying to fund our program. We just don't want their money, because we don't want their rules. But we've saved the government down there so much money, because where do most drunks go that are down in a community the size of Jefferson County? They go to jail or they go to the hospital. If they're belligerent, they go to jail. If they're unconscious, they go to the hospital. They still do, but all the others are brought to us. Intermediate, a good treatment center, a good rehab program with a 12-step format. I'm not disagreeing with Richard, but there are some good rehab centers. There are some lousy rehab centers. You have to look real hard to find the good ones. They know their limitations. They do what they do, and they do it well. And almost all of them are run by people who are in recovery, who have been trained to know what AA is and what treatment is, because AA is not treatment, and treatment is not AA. AA is a spiritual mechanism of recovery. Anybody who calls it treatment, and I understand you have to look at definitions, but AA is not treatment, and that's not where we try to analyze people, and treatment is not AA. But sometimes, for instance, in my case, I was in a rehab program for 3 months, and my brain was so toxic that I really shouldn't have been on the streets for 3 months, because I couldn't make decisions. And there's some people who can't stay away from a drink that long, because their brain toxicity is so great. That needs to be made by pros. But you can send people to AA directly. You can put them into short-term or long-term rehabs. Outpatient treatment programs, I won't say they're a waste of time, but again, they have to be run very, very well, and I'm not too sure that they certainly haven't lived up to their billing. Long-term AA and NA. Stanley Getlow says the number one treatment for stimulus augmentation, the number one treatment for ADHD, the number one treatment for irritable, restless, discontented is improved interpersonal relationships. You know what that is? People loving people. Richard was strong today about love. Sheila was strong last night about love. And AA is a love feast. AA in its simplest presentation for this alcoholic is a love feast. It's where we love each other enough to be honest, tell the truth, stay with each other, never abandon, always support, but hold people up to the scrutiny of the truth. And that's love. When I'm giving this lecture to a group of people who aren't in recovery, I'll say, and most of these people come to want to know about us, I'll say, you, because of your heart, if I came and told you my problems, you would want to help me, and eventually you could. I said, I can walk into that men's homeless shelter with some of these guys right off the street and walk in and sit down beside them and start watching TV. And they'll look over at me and say, hey, Doc. Hi, Reggie. You really love us, don't you? Yeah. You're here to help us save our lives? Yeah. I'm also here to save my ass. And I've sat beside those guys watching TV and reached over and taken the hand of a guy whose hand dwarfed mine, and we held hands and watched a basketball game. And I felt really great. I felt really great. People loving people. Yeah, the first thing that comes back is opinions. And this program really shouldn't work. But it works because there are a number of us who truly believe that we were God's blessed, and hope that you're ready to come with us as we walk this road of happy destiny. I hope I've helped some of you today, and I hope I get the opportunity to help me and some of you tonight. Thank you for being patient. If there are any questions, I'll listen to them.